Welcome to Moments with MamasteFit. In this week's episode, we're going to be discussing pelvic pain, specifically pubic symphysis pain or pain to the front of the pelvis with our in-house pelvic floor physical therapist, Hayley Kava. And so Hayley's going to be doing some of these episodes with us, specifically talking about her experience as a PT, helping folks navigate their pregnancies, preparing them for birth, and then helping them recover. So be sure to check out these episodes because she's going to be giving a lot of insight if you're looking for that information. Welcome to Moments with MamasteFit. In this episode, we're going to be talking about front pelvic pain, known as pubic symphysis pain, where a lot of folks tend to have during pregnancy. You either have pain to the front of your pelvis, to the back of your pelvis, maybe either or both at the same time, because there's a lot of extra movement happening during pregnancy. But it's important to note that pain is not a requirement of pregnancy. There's a lot of things that we can do to not be in pain. And so you'll probably be somewhat uncomfortable at different points during pregnancy, but pain is not something that you have to suffer through. And the resolution of pain is not just give birth, because if we don't address what is actually going on and causing this pain, you may find that after you give birth, you're still in pain. And that's usually a pretty common thing that I see with a lot of our clients. And so, Hayley, let's talk about front pelvic pain.
Yeah. I'd say, SPD, right, is like the lingo that we hear a lot, like, oh, I have SPD, I can't do single leg work, or I have SPD, I can't run, or maybe, running questionable, I can't go for a walk, I can't do any single leg activity, when in reality, like doing the thing that hurts, with being mindful of certain supports that we need there can actually be the thing that resolves the problem. So we were talking about a particular case, and the case that comes to mind for me with this is a client who was having a lot of pain just like going up and down the stairs, particularly up the stairs. And so the first thing that we do is I pull out a step, right? And they're like, oh gosh, like, I really don't want to put my foot up on that. I really don't want to put my foot up on that step. And it could be it can be when one of the feet is down, like it could be the down foot and like the stepping up leg doesn't bother you, but it's like the downside. So if we have two sides of those bones that meet up, the downside could be the painful side, or it could be the leg that's coming up is the painful side. But really it's sort of two halves of the system, and that in order for that to be non-painful, the two sides need to know how to interact with each other. So commonly the solution that we get is like, okay, let's belt this thing and let's keep our legs together so that we're not bothering this middle part that's painful, right? But when like that's not always possible, and there's going to be times where we have to navigate stairs, or we have to, be on asymmetrical surfaces or put on a shoe, right? And so we need to optimize those mechanics. So this sort of fun case is that stepping up onto a step was really, really painful. So then what we did was we pulled out the step, and they were like, no, don't want to do that. And I said, don't worry, we're not going to step up onto the step forwards. We're going to step up onto the step backwards. So we're going to put our foot back up onto the step, and we're going to practice learning how to shift our pelvis toward that state, like the step. Instead of going frontwards, we're going to go backwards. And going backwards is helpful because we don't anticipate the same movement the same way. So if we're always habitually doing things forward, sometimes going backwards helps our brain like figure out a new way how to do it. And so we learn to step back and figure out how to turn our pelvis toward that side going backwards, even though it's different, it's similar concept. And so she steps backwards up onto the step, no pain. Awesome. Okay. And so we take that concept and we go, okay, now we stepped up backwards, didn't bother us. Let's go sideways. And so we're playing with different planes of movement, but we're working on that same concept of I can move at this joint, which is designed to move, which is why it has a big cushion in there. And I know how to use the muscles, mainly our like inner thigh, our adductor, our glute med, in order to, and our abs to help us support that movement now in a different plane. So now we're going to step up sideways. Oh, cool. Stepping up sideways doesn't bother us. And then we step up forwards, right? And so mechanically, we're maybe thinking a little bit more than we would normally think when we're stepping up forward or stepping up sideways or stepping up backwards. But we're teaching and retraining some muscles in order to support that pubic symphysis a little bit better, despite the changes that are happening to our body throughout pregnancy, right? There's more out there now that says, oh, like relaxin or the hormones that cause us to become a little bit more flexible in pregnancy isn't responsible for pubic symphysis pain. And I'm glad that information is out there. But it's just not particularly helpful when we're still in pain.
It's like, thanks.
Cool. It's not because of relaxin. Well, what is it? And right, those changes that are happening mechanically in our pelvis make it more difficult for us to be able to like shift our pelvis from side to side. And so, again, maybe taking a different direction can be really helpful. So another example, like working out wise, might be instead of stepping forward for lunges, why don't you step backwards? Or instead of, like hinging, if you're doing like a single leg hinge or double leg hinge, and that's causing pain, we could like offset with like a kickstand position, things that create a little bit more movement. Or something that I feel like you guys do a lot is like add adduct, like a band to encourage more adductor, or a foam roller to encourage more adductor, so that we're still getting that good hip shifting movement that we want, but we're helping our muscles figure out how to do that.
That's something that I have found to be really helpful for our clients that are having any sort of pelvic pain, both on the front or the back, is we just add a resistance band around like whatever the forward leg is. So the band will be around the inside of the thigh, pulling it out sideways. And then as they do their reverse lunge, that inner thigh activation, like they tend to find like they don't have pain with it, just because we turned on that muscle. This helps to stabilize a little bit more. And then we'll add in more rotation. So as they step back into the lunge, they're bringing belly more towards the thigh, keeping that knee stacked over the ankle. So we're adding in that movement within the pelvis to help them stabilize. And they're like, oh, I feel a lot better right now.
Yeah.
And so that activation or that just feedback is like really helpful for them. And so we've definitely found that to be like super helpful, which is why we incorporate so much of it within like our programming, because it really does help folks feel so much better to just turn that on just a little bit more.
Yeah. And I think once we know we can do something without pain, then that helps shift that perspective mentally so much, right? And knowing like, oh, I can do this. I can step up a stair and it's not going to hurt. Also causes us to not like tense our body or like pre-anticipate this discomfort. It's almost like that pre-anticipation of discomfort is keeping us stuck in the position that's causing us pain. Right?
Yeah.
And so like both retraining muscles and also retraining those like mental loops is so helpful.
Usually I find when folks ask us about pelvic pain, they say, what's the best stretch that I can do to resolve this pain? They ask about like seeing a chiropractor or a belly band. So they're looking for kind of those like quick fixes. Like, what can I do right now to not be in pain anymore? And I find that there really isn't like a stretch that is helpful. It's more of like strengthening exercises. So if you had to pick like a few exercises that you find to be generally very helpful for somebody with pelvic pain, just to give them that first step to relief, what would those exercises be?
I would say exhale all your air out. So like deep abdominal work. So like blow all your air out. Right. We want to think about those ab muscles attach all along the bottom of that pelvis. So we don't want to forget about our kind of core muscles when we're thinking about pubic pain. So anything in all fours, and we could bring in like a block in between our knees and all fours, right, to start to initiate like how do we get those muscles to work. So maybe that's where we're hovering knee hovers or like that type of thing, I'd probably start with that. And then we could work on hip shifting in maybe supported positions. So maybe in side lying or on our back or even on all fours, we're working on controlling that hip shifting with fewer variables. So we're not necessarily starting up on our feet with a hip shift, which is more complicated, right? Or up on a stair like I was talking about with that client. But we can start to learn like the components of that movement. And then we bring it up onto our feet. So like it's a kickstand deadlift or a hip shifted deadlift or a hip shifted step up with the band is then our more complex movement. But now we're taking the components of all of those things so that we're now building on that in order to optimize how that pelvis is moving. So that hopefully when we're doing things in our day-to-day life, we've integrated that concept, right? And so now I don't have to think about a hip shift or an inner thigh. It's my body's just doing that, probably the way it did that before maybe pregnancy changed the way we were doing that. And then we feel good. Then we don't have to think about it anymore.
Exactly. Is there anything going on with the pelvic floor that you notice with someone who has more like pubic symphysis pain versus like SI joint pain of like different trends that you've seen? Or is it kind of all the same and just presents differently?
It'll vary person to person. I think when we tend to be anticipating pain in the pelvic floor, we'll maybe see a little bit more hyperactivity in those pelvic floor muscles. So pubic symphysis in the middle, our pelvic floor, right? Our superficial layers of our pelvic floor are here and here. And then our deeper pelvic floor also attaches like right up under that pubic symphysis. So it's right up in there. Our inner thigh muscles, our groin adductor muscles, they're bigger muscles than these. These muscles are pretty thin and pretty small. These inner thigh muscles are attaching all along here. And so they are interacting with each other pretty closely. So if these inner thigh muscles, as we go further and further into pregnancy, are kind of getting shut down because our pelvis is moving more forward and these muscles are getting elongated, we tend to like turn out and get into that waddle sort of movement pattern, right? The adductors now aren't maybe doing their job to support this pubic symphysis. So then that pelvic floor goes like, oh shoot, we gotta hold on here and support this pubic symphysis. But it's not really their job, right? Like the pelvic floor muscles are designed for controlling our pee and our poop and orgasms. And so their job is not really orthopedic support of the pelvis. And so what our job is in rehab and through programming to support our pubic symphysis is to teach the big muscles on the outside of this pelvis how to effectively move their pelvis so that this pelvic floor doesn't have to take on jobs that it doesn't need to do. So I would say we might see a little bit more overactivity in these muscles. We might also see that go along with like some urinary urgency or a little bit of like bladder leaking with certain activities or maybe some constipation, right? And so we tend to see some of these things coexist. It's pretty common where if we saw someone with like a lot of pubic symphysis pain, that they wouldn't have maybe a little bit of bladder urgency or frequency or leakage also happening at the same time, just because like our urethra is right there. Our pubic symphysis is right there. Like they're pretty close in geography. And so, it's not unheard of that they would be happening at the same time. I'd say things like pelvic belts, right? Like the Sorolla belt is a pretty common one. Isn't wrong or bad, right? If you're having severe pelvic girdle pain, use the belt, right? Like use these supports that we have. I remember with my second, if I had a really long work day, I'd wear the freaking belt by the end of the day. But in combination with getting the supports the other muscular supports that we need being really helpful. And then I think just like the mental hurdle of knowing like, oh, this can get better is huge. Because I think a lot of times we have this pain, we go to our provider says, sucks to suck, you're pregnant. And then like that's harder to overcome than, oh, this is a common thing in pregnancy. I can deal with this. I have tools and strategies and I don't need to be afraid. It's like half the battle.
That's how it was for me in my first pregnancy. I had like pretty bad SI joint pain where I was having a hard time walking. And I brought it up to my provider and I was like, hey, like, what can I do for this? And their response was, you just have to give birth. Like, there's no solution to it. The only way to resolve it is to give birth. And that was so defeating to me, where I was only like 5 or 6 months pregnant at this point, and I was like, that's a really long time to not be able to walk.
Right.
Or to like, I'm like, I can barely squat. Like, I can't even work out because it's so painful. And so I ended up working with a chiropractor who did a little bit more like, she wasn't a PT, but she did some PT type exercises with me. Like, it was more than chest and adjustment that I found to be like really helpful to just kind of move things a little bit more. And it kind of gave me that confidence to where I can go back and start working out.
Do something,
And that was really helpful. And then after that pregnancy, I started learning more about these different myofascial slings and how all these muscles connect. And that really helped me with subsequent pregnancies, and then helping to develop more of our fitness programming to help folks be pain-free throughout pregnancy.
Yeah, absolutely.
But it took time to like figure all that out. And once I had the tools, I was like, why doesn't everybody just know this? Like this has made my pregnancy so much more comfortable. And then in my last pregnancy, I worked with you at the end. I was having a little bit more of that same SI joint pain. I feel like pregnancy just kind of like exacerbates like whatever issues I had pre-pregnancy. Because I think I just sink into positions a little bit deeper than normal. And so I was having that same SI joint pain. It was still pretty manageable. It wasn't like I could still walk and move pretty freely, but it would just kind of like ache every once in a while. And the combination of like the exercises in addition to like internal pelvic floor release was like really helpful, which was something that I had done in previous pregnancies with just like a pelvic wand. Like doing the release work, I found like really was like the next step of of my pelvic pain relief journey. And so I was doing just kind of like the manual therapy with chiropractic care. Like I would wear a belly band, like if I had a really long day on my feet, to just help with fatigue. I was also doing like my exercises to help with the myofascial slings, adductor strengthening, like just helping all the muscles that support my pelvis do their job has been really helpful throughout my pregnancy. And then adding in that last step of like internal work to kind of finally help some of those pelvic floor muscles that are just kind of hanging on like to release was like such a game changer for me, like at the very end.
Our brain's map of our pelvic floor is not great. So like if you have a cramp in your hand and like you have a hand cramp, you're going to know exactly where that cramp is. If you have a tight muscle in your pelvic floor, our brain's map of that is not the same, right? So we're not going to be like, oh, it's like right here. I can feel like right pinpoint where that spot where I'm holding tension. It's not that clear. And so sometimes it's super helpful to have a pelvic floor PT go and say, like, really kind of get into those areas specifically where we can identify this particular areas where we're holding things tight. Let's help your brain make a connection to that area. And then really the pelvic floor being just sort of a part of the system of that pelvis. So now that pelvic floor that was maybe holding on, maybe stopping that pelvis from being able to like move freely, now we have a better understanding of how those two things interact. Because really I always say like the pelvic floor should just be following along with what that pelvis is doing. It's really not, shouldn't be driving the show, right? And often when we run into problems is when that pelvic floor is like, oh, we're going to help. Like we're going to take over and do these jobs that really those other muscles should be able to do.
I think one of your favorite quotes of mine is your pelvic floor is the victim.
Yeah, totally.
It is now the culprit in a lot of the issues that we are having within our pelvic floor. So let's finish up with just our recommendations I'll give some recommendations to like the pregnant person, and then you can give some recommendations to the PT that is maybe treating folks that have this condition. So if you are pregnant and you are dealing with pelvic pain, my recommendations are to one, work with somebody who can help you, because it is not a requirement of pregnancy by any means. And so if you have access to a pelvic floor PT, like I would highly recommend it. Chiropractic care can also be a helpful thing if that's accessible to you. I find that helps more with kind of like the temporary relief, and then the PT helps with more like the long-term relief in my experience. Wearing like a belly band or like the SI joint, like belts, can be really helpful for some of that temporary relief as well. But we need to be doing exercises to strengthen the muscles that help to support the pelvis. So adductor strengthening exercises that focus on different myofascial slings. So we have different slings of muscle that move through our body that connect with one another, that help to stabilize and support our pelvic joints. So doing those type of exercises can be really beneficial. We incorporate them all within our prenatal fitness programs and within our pelvic stability course. And we have tons of content on myofascial slings. So if you just go to our blog and you type in pelvic pain, there'll be like 15 blogs that pop up with tons of exercises that you can kind of browse through. But typically I find strengthening exercises are more beneficial to resolving pelvic pain than tons of stretching. And so if you're only looking for the stretches to resolve the pain, we're kind of missing a key point of it, and we need to come back to the strengthening. So if you are pregnant and looking for pain relief, work with a professional if possible. Wear some sort of support devices for some of that temporary relief. And then we need to incorporate strengthening exercises that are one-sided. I know single leg movements can be really scary with pelvic pain, but we need to get to those movements to find a lot of that relief with a lot of the hip rotation and strengthening the muscles that help to support the pelvis.
And if you're a PT that's working with clients who are dealing with severe pubic symphysis pain, I think one of the first and biggest things that you can do is not reflect their fear, right? So if your client is super anxious and worried and scared about this pain, we don't need to add gasoline to that fire and, give that back to them. Reflecting back to that patient that we know this is not related to just this relaxin hormone, knowing that the more we tense and hold our body and hold our breath, the worse that pain is going to be. Talking about anatomically how this pubic symphysis is supposed to move and what muscles connect to that. And then being able to assess and evaluate maybe where areas in this individual are dealing with maybe overactivity or underactivity of certain muscles in order to help restore that normal motion of the pelvis. And then using tools like belts or other supports sort of as needed for symptomatic relief. Or if you use other modalities like dry needling or whatever to help sort of as an adjunct to that. But I think a big key is not being afraid to help normalize this person's gait mechanics in order to help resolve their pain.
So thanks so much for listening to Moments with MamasteFit. We're going to release these episodes every other Friday in conjunction with the birth story. So it'll be birth story, Moments with MamasteFit, where we're going to be sharing our professional experience working with clients throughout their pregnancy, their birth, and in the postpartum so that you can learn more from our professional experience. If you want to learn more from us, check out our online prenatal fitness programs and online childbirth education course. But if you're postpartum, check out our postpartum fitness programs for a guide to help you move confidently throughout your pregnancy and in the postpartum. If you're a professional, check out our professional education courses. And coming this summer, we'll have a much bigger professional education course available where Hayley is going to be contributing to as well. We're going to teach you all about the pelvis, different things that you can do to help support somebody throughout their pregnancy, their birth if you're a birth worker, or help prepare them for birth if you're a perinatal support person such as a PT or a fitness trainer, and how to support them in that early postpartum phase. So if you're a professional and you want to learn more from us, be sure to sign up for our newsletter so you get notified when this new course comes out this summer.